are some of the first ideas and goals that you want to tackle whenever you take over this position?
Well, we're still in the transition phase of our leadership transition. But I can tell you that my goals and objectives for Willis-Knighton are going to resemble what you've seen from Willis-Knighton in the past, which is an organization that is committed to this community, that's committed to offering convenient access to high-quality care, high-quality health care in our area.
So you're coming into this position in the middle of a pandemic. That's got to be very challenging for someone. How do you make sure that hospitals that have been struggling so hard through COVID continue to be successful in a transition so large as this?
Well, I'll tell you, this past 18 months have been probably some of the most stressful times for Willis-Knighton in the 30 years that I've been here. Mr. Elrod would tell you the 56 years that he'd been here. Our employees are tired. Our resources are taxed. Our employees are coming to work every day. In some cases, they're working 40, 50, 60 hours a week, pouring their heart and soul into taking care of these patients. It's very taxing. Some of the stories you hear coming from the units are very heartbreaking. One of the nurses told me the other day that the nurses that have graduated in the last 5 years have seen more death than most nurses see in a lifetime. And it's just a shame. And it's hard to imagine the sacrifice that our employees are putting in on a day-to-day basis, trying to take care of the people of this community that have come down with this dreaded disease. But I'm going to tell you, Willis-Knighton employees are resilient. We've always said that the number one asset of Willis-Knighton is its employees and its medical staff. And as we move forward, I know that we're going to be stronger after we go through this pandemic.
When you start to make decisions or think about decisions, will you consider coronavirus and how that may play a role in some of those decisions you guys make moving forward?
Certainly. You mentioned a minute ago about the goals and objectives. This pandemic has changed the way a lot of healthcare executives are looking at healthcare going forward in the future. It certainly taught us a lot of things. Over the next couple of months, I'm going to be talking to community leaders, employees, physicians, and department heads, and we're going to be developing our fundamentals for the future, and we're going to roll that out in the future. But like I said earlier, that's not going to change the way that Willis-Knighton views its commitment to this community. We're going to continue to be a high-quality healthcare provider as we move forward.
You guys continue to get bigger and make major steps, and one just recently with the addition of medical classes. I believe you sent out a release on that. Is that something that's important to you in the future?
It's definitely important to the future of Willis-Knighton. We've just embarked on a new program that's going to offer residents and fellowship opportunities for med students in our community. And we're doing that to give, there's a big gap between the number of med students that graduated and the number of residencies that are available for those med students. And so Willis-Knighton wants to develop these residencies so that we can encourage physicians to come back to Shreveport, to come back and take care of our community and practice their medicine here.
You had 30 years of experience here.
Mm-hmm.
A lot of times or all of that time you've spent under Mr. Elrod. Is it challenging to sort of, in a way, live up to his 56 years of expectations?
Shoot, there's no pressure whatsoever. What are you talking about? 56 years. It's been the joy of my life to work at Willis-Knighton for 30 years. I came to this organization back in 1991. I'll tell you a funny story. Back in 1991, I came in and had an interview with Mr. Elrod. I walked in the front door of the hospital, and as I walked in the front door, I noticed that there was a man in a suit and tie picking up trash on the outside of the hospital. And I said, well, I didn't really think much of it as I walked in. I went into his office, sat down, started talking to his assistant, and about 5 minutes later, that gentleman came in, introduced himself to me as James K. Elrod. And I thought, how cool is that the administrator of this hospital is outside picking up trash, and that there's nothing that he would, ask you to do that he wouldn't be willing to do on his own. And I said, that's the type of organization I want to work for.
Will we be seeing you pick up trash?
I have done that. He's instilled that in all of us. So that's pretty much something that we do. We have a tremendous pride in our health system. Our employee culture has been cultivated that way. Even though we're as large as we are, Willis-Knighton still has a family feel. I can walk the halls of any of those hospitals and people will know me by name. And it's not because I'm Mr. Popular, it's because we're a family. You know, as large as we are, this hospital still has a great culture and a family culture. If you think about it, you spend more time up here or at work than you actually do at home with your family. And so we enjoy working with each other, and it's just a great place to work. Been very lucky to work here.
Has it always been a long-term goal of yours to become CEO of the hospital?
I will tell you that when I came to work for Willis-Knighton, I instantly fell in love with the place. And like most young people, I wanted the opportunity to move up in the organization. Never thought I'd have the opportunity to be president, but I think it's highly ironic. I was going to tell you the end of my interview with Mr. Elrod after I met him in there, after he was picking up trash that day. We went in, had a great interview. He's got a great sense of humor, and I've got a great sense of humor. So we were cutting up, and on his way out, he said, "Son, what do you want to do when you grow up?" And I looked around his office, and I said, "I'd kind of like your job one day." And I think it's highly ironic that that's come to pass, and I'm very humbled by this opportunity and very excited about what Willis-Knighton is going to do in the future.
So what's the past years or so been like, knowing that there's going to be a transition or a change of hands? And when did you realize that you were a front runner for this position?
Well, it's probably happened within the last month. You know, Mr. Elrod has actually over the last 4 years, we've been going through a succession process. And we've had different candidates come in, and the board of directors contacted me about a month ago and asked for a resume, and I was considered, and 2 weeks ago was unanimously approved as the CEO and president of the health system. So that's very, very humbling, and I'm very proud to have had that opportunity.
Unanimously by your board, that's got to be confident boosting.
Yes, and you know, you talked about transition earlier. I think this is going to be a smoother transition than most transitions because I'm a known person. I mean, I've worked here for 30 years. The physicians, the staff, the employees, everybody's comfortable with me. They know what my background is. They know what my goals and objectives are going to be. And so I think it's going to be a smoother transition because of that.
What are some of the challenges you feel like you'll face in your first few years of?
Well, other than living up to the reputation of Mr. Elrod, I'm sure there's going to be several challenges, you know, but Willis-Knighton has been very resilient to change. I mean, you look back at the things that we've had to go through these past 18 months with COVID, and then we had Snowmageddon, and then recently we've had a bunch of evacuees come up here from South Louisiana because of the storms. And I could tell you another story that I heard the other day about our staff. I mean, I told you earlier, they're tired and they're spent about the amount of hours that they're having to take care of COVID patients up here, but they're not so tired that some of them wouldn't go volunteer at these shelters to take care of the needs of these evacuees on their own time, and that warms my heart to know that our employees would do something like that.
What will you miss most about not having that guidance and leadership in the office?
Well, honestly, I don't think I'm going to miss anything, and I don't say that disrespectfully because Mr. Elrod is going to be assuming a president emeritus role here at Willis-Knighton. So he's going to be moving across the street. He will be available for consultation. He's going to continue to work on projects that he started over the last several months that he wants to see to fruition, and we're excited to have him on this campus and want him to be a part of our future going forward.
At the same time, is that concerning for you, though, since he's really not technically taking all hands off? I mean, do you feel like you're really being able to become that leader position that you want?
I'm very comfortable with that. Mr. Elrod is going to relinquish all operational control. So after October 1st, I will be inhabiting his office, which means all that will be coming to me, and he'll be able to go to his new office and concentrate on the projects that he's been dedicated to over the last couple of months.
He just can't let it go, can he?
This is his baby. And quite frankly, I understand that. I mean, he's worked here for 56 years. He's been on call for 56 years, every weekend, every night. I mean, it's hard for him to put that down, and I respect that. And I think he's still got a valuable contribution to make to this system in the future.
You're at LSU grad, correct?
Well, I'm an Abilene Christian University grad.
I know where that is, yeah.
And I went there in 1985, graduated with my MBA, and came back home. And in that same interview that I was telling you earlier, Mr. Elrod picked apart my resume and told me that I needed an accounting degree. So I went ahead and got an accounting degree from LSUS at that time.
Okay, so, and you're also worked in human resources.
That's correct. Started there.
How has that helped you as far as, I mean, you have 7,000 employees. How has that helped you as far as navigating that many employees and that many challenges that you may face with in regards to employees' wants and needs?
Well, HR is a big role here at Willis-Knighton with 7,000 employees. There's always issues that we need to take care of. I think the advantage that I've had is I have worked with the majority of the department heads. I've worked with the majority of the employees in either events or the Louisiana State Fair Appreciation Day that we've done, so people know me. And I think that's the main thing that I bring to the table is I'm a known commodity here at Willis-Knighton. I think that the employees know who I am and know what I stand for, and that's what's going to make this transition a lot smoother.
Mr. Elrod, a lot of people know him throughout the community. What, for people who don't quite know you yet, what do you want people to know about Mr. Fielder?
That I am 100% committed to Willis-Knighton and I'm 100% committed to Shreveport. I'm Shreveport born and raised. Other than a brief stint at Abilene, Texas, that's where I've spent my entire life and entire working career. I know that the value that Willis-Knighton brings to this community. We are a huge economic engine. We employ 7,000 people, 1,000 physicians, so over 8,000 people depend on Willis-Knighton for their employment. And that's a big responsibility, and we're going to continue to remain local. Willis-Knighton is the only local healthcare provider in this area. All of our profits are invested locally. We deal with local vendors. Our headquarters has been located in Queensboro neighborhood for 98 years now. So we have a tremendous presence here, and we're extremely invested in this community and will be in the future.